Hi everyone, I'm medical doctor Vania Utami, here to help you to stay healthy even during the holiday season. The holidays are a time for fun, family, and food, but it's easy to let our health goals slide. Don't worry, I'll share some simple tips to stay fit without missing out on the special occasion. First, prioritize movement. Even if your schedule is packed, try to include at least 20 to 30 of physical activity each day. This could be a brisk walk, jogging, or even a quick home workout, like squatting or planking. Remember, every little bit counts. Second, smart eating. It's okay to indulge in holiday meals. The key is balance. Fill half of your plate with vegetables or fruits, and then enjoy smaller portion of your favorite festive treats. Also, remember to not skip meals as it can lead to overeating. Third, stay hydrated. Aim to drink at least 8 glasses a day, as staying hydrated can help control craving and maintain energy. Fourth, balance sleep. Staying up late for celebration like New Year's Eve and Christmas is fine, but you need to adjust your sleep schedule by going to bed and waking up slightly later. Take a power nap during the day. You want to stay up all night and rest the following day to ensure your body's recover. Enjoy the festivities without sacrificing your health. The holidays are about enjoying the moment, and staying fit is about balance, not perfection. Make small, mindful choice to care for your body, and you'll start the new year feeling amazing. Thank you for watching and happy holidays. Stay healthy and see you next time.
So don't forget to like and subscribe.
Okay.
Welcome back to the C Morning Show, everyone. That was Dr. Vania Utami. Doc, come on over and join us.
Hello, doctor.
Hello.
Thank you
Welcome
for
to the
coming.
show.
Thank you for inviting me.
Have a seat.
Please
So
don't.
what we
so
gave our
much.
viewers right there was a little bit of a teaser of what it's like to watch an actual doctor through her digital content. And now we're going to have a chat with medical practitioner and content creator herself, Dr. Vania Utami. She makes healthcare content in order to educate the general public. Thank you for being with us this morning, by the way.
Thank you so much for inviting
I
me.
really enjoy when you give us a tip.
I agree with all the tips, by the way,
Exactly.
especially overeating and resting. Like that's that's a
Power
lot.
nap is really important.
Power nap, yeah.
Exactly, right?
Right.
So, Doc, how did you go from practicing medicine in a clinic to creating content on YouTube?
So actually I started in pandemic, COVID-19.
Okay.
And I see at that time that is a lot of misinformation. Even though people can access information like easily, but there's a lot of information. So I want to contribute, like to create a content and ensure that people can access the right information and also research-based.
Oh, okay.
So speaking of access, a lot of when we talk about the medical field, it's just so vast. People are looking for different types of information. For example, I like to look for fitness information, nutrition. Some people like to look more about certain diseases. How do you create your content and curate it so that it reaches the right targets for people who are trying to find certain or specific types of information?
Okay, so at first we start with planned. So we plan what the topic in the channel and also what kind of audience that we want to help, what we want to provide in the content. So I choose at first is preventive health. So like prevent diabetes. It's important because right now there's increasing of sedentary lifestyle that can lead to diabetes. Also increase of too much sugar intake. It also can lead to diabetes. So diabetes or preventive health, that's one topic that I choose. And also medical education, because I'm not only want to cover to the general population, but also to the future doctors. I hope that the content can help them too.
Oh, okay.
Nice.
So it's like a pre-learning
process.
In order to guide those who have maybe have an interest in the medical field.
Exactly. So, Doc, how do you balance your responsibility as a doctor, because we know a doctor will have a very packed schedule to manage with the patients, with everything, and to make a content, because we know that as a content creator, it's not an easy job at all.
Yeah, maybe people that see sometimes think that I'm only doing content, but actually I also pursuing my residency program in Universitas Indonesia, and also before that I also practice. And how to manage that is the key point is actually the management skills, the time management as per and prioritization is important, and also sometimes people don't know that I tag the video at midnight, like 1 a.m.
Oh, wow.
And after finish all those activities, all responsibilities, and in the midnight I tag video. But people maybe don't know that.
So
Yeah, they see it in the daytime. They think, oh, she's doing this throughout the
and
day.
also you have to be responsible about the accuracy that from the information that you share to your audience. And how do you manage those information are accurate and then accessible exactly for your audience?
Actually, I have a checklist. We call that evidence-based medicine in medical fields. So I use those checklists and ensure that the information is right and also up to date. And also I have to ensure that people understand, right?
Yes.
Because medical stuff is kind of hard. So I just have to ensure that the information is easy to digest.
Okay.
What is your opinion in regards to? There's a lot. You mentioned misinformation earlier. I also attribute the fact that there's so much information out there that not every person is qualified to give this info. Like you are an actual doctor, you can actually give information that is valid, that is based on medical research. But there's a lot of people out there just giving advice like, hey, this is what you should do, this is what, and this is actually regarding health, which is very important. So what is your opinion in regards to how social media is being used so much right now by those that may not be qualified to give this sort of information?
Actually, maybe that's a good start that people want to share health tips.
Okay. They mean well, right?
Yeah, right, that means well. But maybe we can guide them how to access the right information, maybe based on research journal, not from like anonymous blogs.
Okay.
That's what we need to lead them to give the right information.
So for us, like as those that consume the content, we need to know as well, like where are you getting this information from, right? That's why you provide proof of your research and things like that.
Yeah, I sometimes like giving, not sometimes, a lot of time, most of time, like I insert the reference on my description.
I always look for that too. When it's important, I want to know like where did you get it from?
Related to the healthcare,
Yes.
and then sometimes just straight into our body.
Yeah, so beware, guys. If you're consuming this content, like make sure that you know where your sources are getting this information.
Exactly. And one thing that I noticed since the pandemic, it's so easy to get the access for healthcare facility thanks to the internet. So, doctor, do you feel there is a growing need for healthcare to, as a professional, to also appear online?
In my perspective, I can be wrong. In my perspective, yes, it's important to appear. Why? Because I noticed that people need information that accurate and up to date, and sometimes the people that have access to that kind of information is only a medical doctor with certain specialties.
Right.
And sometimes people can access the information, but they have no idea what's the meaning of the paper, of the research, so they need skills too to understand what is the content and the context. So, yeah, I think medical doctor can give more benefit and can help people through that.
Okay.
That would be the benefit for the general public, right?
Yes.
For us as well. What about the benefits for you? How do you feel that having an online presence has benefited you as a doctor?
For me, I think I can have opportunity to collab with like fellow medical doctor and also with stakeholders and also with organizational and also like this a health
Yes.
talk show like
Of
this.
course,
Yeah.
I think nowadays people are really important to understand that they have to quote sell themselves in order to give information, the right information from
Yeah.
the right person,
Yeah.
like a doctor. So it should be a doctor to share the information.
Yeah, and I think collaborative efforts are very important. Like I'll give you an example. I consume a lot of fitness content. I love it when my favorite fitness content creator collaborates with a nutritional expert, and then they can give both of their takes and combine
Exactly.
it into one, and for me to get like a kind of wider perspective
Yes,
on the
and
topic
people
that I
who
want.
don't know anything about the fitness
Yes.
and want to start, also they know how to start,
Correct.
where
yeah.
to go.
It's a good starting point.
So, doctor, what disease nowadays? Speaking about this health situations, people easy getting sick because of the weather. Sometimes we blame the weather.
That's not true, I don't think, right? The rain made me
do
sick.
sometimes. So, speaking about that, have been what disease have been rising lately? And as a content creator, how do you keep up to date with current disease? Or is there any disease that we have to
Be aware of, yeah.
Exactly.
To be aware is actually like diabetes again.
Yeah,
wow,
still.
that's
But
such a big thing.
currently, there is increasing numbers of flu.
Okay.
Okay,
A
flu
lot of-
season.
flu season. A lot of people nowadays having a cough, flu symptoms, and that's why it's important to be fit, like I mentioned earlier.
Do you base this sometimes on your own practice, like, or you're in the medical field, so you understand what ailments patients are feeling. So if you see a rise in that, do you use that as a base point for you to, hey, maybe next time I'm going to create the content on this because this is something that seems to be on the rise lately. For example, if many patients are coming in with symptoms of flu, then that way you're like, maybe we should talk about flu season a bit this year and how people can prevent themselves from a flu. Does that ever happen? Do you ever do that?
Yes,
Okay.
of course, because when the increase is significant, I will think that I should create this content so people can prevent, or people can treat themselves at first before going to a doctor,
True.
and they can know when to seek a medical treatment or not.
Yeah, it's that way we don't panic when we're at home.
Yes.
Sometimes when we have symptoms, nowadays we just we'll look it up, right? We'll search and see what
then we'll
am I
feel-
having right now.
Exactly.
No, you do it too.
So, okay. Is there any challenge that you face, doctor, since you have to you creating your own content, like you are the one who make decisions for the team, for the topics that you want to share and how you want to deliver it, and you also have to think, how about my audience? Are they going to understand what I said? Because you are from you are the medical professional. So what is the challenge that you face?
The challenge is actually how to make easy to understand content.
Okay.
Because for me itself, I'm struggling about that.
What is the common bias that you probably receive from your audience, or probably you read on the comment sections?
They don't understand some topics.
Some of the technical, yeah, because it's very technical, right?
Yeah.
When it comes to medical stuff.
And I think that I understand that. Maybe people also can understand that, but no, I'm wrong.
That's
so
true.
I have to keep learning about that.
Yeah, I find that whenever it's very tricky. There's a fine line between when you start using too much medical terms
Yeah.
that the general public won't understand. It's harder to
What do you
digest.
do, Paul, when you find a very difficult word?
I'll use nutrition as an example.
Okay.
Nutrition, when they start talking about how the biology of your body works and how certain chemicals react with what you're eating, I get confused. I start losing it because it's all too technical. I think the best way to do it is just to give certain examples. I think when you give examples, I find that. And I mean, do you do that sometimes with
Yeah.
your own patients that you've had in the past? And then you can use an example? Because when I hear an example of somebody going through something I'm going through,
Yeah.
I can relate to that a little
Yes.
bit better. Is
Yeah,
that sometimes?
I'm using example, but sometimes that example only relate to certain people and not relate to other people.
True.
Okay.
Yeah. So it's a bit
still
tricky as
challenge,
well.
right?
Yeah,
Because
very
we are
much so.
Common people like me didn't know anything about the sometimes medical terms or something, but we know that we had. I thought we had it, and then we don't know. So what I'm doing is I Google it. I go back to
Do
the
an
search
online
engine,
search.
and then I become very confused, and I go back to the doctor.
Yeah, you go back to see Dr. Vania in person. So let's talk about personal branding. Obviously, when you have to have an online presence, you need to focus on personal branding. What do you do to focus on your personal branding in order to make your online presence be more legitimate, so to speak, so that people will know, oh, I can check out Dr. Vania's content in order to find out what I need?
So for that, actually, I maintain like guideline, but not written guideline. I mean, guideline only for myself. So I need to be professional, but also relevant, and also that again, that create easy to digest content like that.
Because it's very important to have a personal branding nowadays, since you're a doctor but / content creator. So, and people looking for you to get new information. Sometimes people get burdened when
It's overwhelming.
overwhelming. But she can't stop because we need the information.
That's right. All right. So in regards to those out there, you mentioned that this is not just for the general public like us, but for those that perhaps have an interest in the medical field. What would be your advice to them? Because obviously going to school to become a doctor is like a long and arduous process. Should one focus on that, or can one do it parallel to being a content creator as well, such as yourself?
For future doctors?
Yeah, for future doctors.
So future doctors, I think they need to keep learning, because in a medical education, we have terms like lifelong learner, lifelong learning, and we always have to keep learning because people nowadays are very smart. They can access information everywhere. And also I think they need to improve the skills, like soft skills.
Okay.
Like not only public speaking, but also content creation is.
Like editing.
Yeah, editing is important too.
I think so too. I think like communication skills. I mean, it used to be like if you were a really good doctor, you could just be a really good doctor. But nowadays, you need to have that communication skill as well, because if you need to express yourself in front of a camera,
And you
you'll
have to follow all the social media activities. So
right.
you have to keep updated, right?
Absolutely.
All right, doctor. Thank you so much.
Doc.
Thank you for coming. Thank you for your sharing as well and your experience. Best of luck for your content.
Indeed.
And your study as well, doc.
All right. All right, we're going to take another short break here, but when we return, in case you did join us late, don't worry, we're going to recap some of our earlier stories from around the world when we return here on the C Morning Show.